Hi, I'm Mary Culpepper, CEO and Principal Agent of Mid-Michigan Health Insurance Advisors, MMHIA, the first of its kind standalone full benefits portal designed to help employers get out of the benefits business by migrating their employees to our self-service portal. Employers can offer tax-free allowances and contributions to their employees using a QSCHRA for small groups and an HSA for larger group employers. Most employee benefit portals are connected to company-sponsored benefit plans and allows access for employees only. We are the first to offer a decentralized model that provides a gateway to affordable plan options. Our platform allows flexibility for the employer as well as employee. The employer can offer our portal as a standalone benefit option to their employees, or bundle our solutions to enhance the benefit package, or individual employees looking to take control of their benefits with more affordable options can sign up on their own. Much like gas station attendants of the 60s and 70s, the life and health industry is undergoing the same changes. Individuals will serve themselves with proper instruction and education, and our benefits department will offer guidance, consultation, and resolve any issues expediently. Individual employees that sign up for our benefits portal as a standalone benefit option will realize an average cost savings of $100 to $300 per month. Employers that elect to couple our self-serve portal in conjunction with our employer solutions can save an average of $2,500 to $5,000 per month over and above a traditional group plan, with an increased savings for the employees of $300 to $500 per month, with an additional tax savings incentive for both employer and employee. With this option, employers can help drive down costs, provide more options to their employees with greater tax incentives. The health insurance industry challenges for employers brings quite a few challenges, such as annual rate increases, participation fallout, diminishing plan designs and features, and additional administrative burden. For employees, individual health care reform has made it much more confusing and frustrating for the average consumer, and the healthcare.gov access portal to obtain a qualified health plan does not offer enough information and guidance to consumers to make the most informed choices for health insurance coverage, and many other challenges that have caused consumer confidence to be at an all-time low. The solution, however, is now that the individual plans are a guaranteed issue, meaning no one can be turned down based on pre-existing conditions, and offers minimal essential benefits, it makes the most sense for everyone to have their own individual plan that we will help manage as your benefits department, regardless if you're one individual or if you're a company of thousands. And here's why.
According to a study by Harvard Law and medical schools, nearly half of the Americans who file for bankruptcy do so because of medical expenses. But that is not the real shocker. 3/4 of the people who filed for bankruptcy because of medical bills actually had health insurance. Another eye-opener, 80% of the 45 million Americans who are uninsured are employed, and 16 million earn more than $40,000 per family. And it's not just individuals who are suffering from escalating health care costs. Employers are too. Last year, for the first time ever, the health care costs of the Fortune 500 companies exceeded their combined profits. But help is on the way. There is a revolution occurring in health care insurance that makes it easier and more affordable to get the coverage you need. We'll discuss what it is and how to get it next on Consuelo Mack Wealth Track. What is the new health insurance solution that all of us, especially pre-Medicare, should be aware of? What are the solutions that are out there that we should know about?
The primary solution is that everyone should get health insurance independent of their employer. Health insurance should not be tied to a job, especially because very few people keep that same job until age 65. If they find themselves fired, retired, or just want to early retire before age 65, the greatest missing hole in their financial plan is how do they get health insurance between age 55 and 65. In contrast, if they bought an individual plan without an employer before that happened, an individual plan, you're locked in based on your health. You get underwritten, you get looked at, and in 46 states you get a very cheap rate if you're healthy. But then if you get unhealthy, your premium cannot be raised because of illness. It will go up with your age, and it will go up with general inflation, but you can have $1 million claim and they can't raise your premium 1 penny for it.
All right, so let me stop you there. If I am covered by my employer, do I drop it?
Mixed question.
Yeah.
How are you covered by your employer and who's paying for it? Most major companies pay for the employee, but today require the employee to do withholding to pay for 50 to 100% of their spouse and children.
Right.
If you have a healthy spouse and healthy children, run, don't walk, and get them an individual plan. It will be much less money than your employer plan if they're healthy, and now you've got them permanent coverage if you retire early. If you are getting free coverage from your employer, it's going to be a mixed bag. You're going to say, I'd love an individual plan, even at half the price, but it's not half the price because my employer is paying for it.
Right.
But help is on the way there, too. The fastest growing phenomenon in health insurance today are health reimbursement arrangements, HRAs.
Right, HRAs. Tell me about HRAs.
With an HRA, an employer says, I don't know about your health care, I know about money. You work here, I give you money. I will give you a tax-free allowance of $300, $500, $1,000 a month. You go buy your own health insurance and keep me out of it, totally tax-free.
All right. So now, are employers actually stepping up and volunteering to do this, or do you have to go and ask them what do you do if you are employed and you are being covered by health insurance at your employer?
Employers are giving you an option. For example, last week Ford Motor Company, in one decision, took 28,000 white-collar early retirees and said, you're off the group plan, here's an HRA, go buy your own policy. That's happening throughout corporate America. But if you don't work for a company that has an HRA, you should ask. When you go into your employer and say, we would like a choice to opt out of our group plan and get $200, $300, $500, $800 a month, the employer may not know about HRAs. HRAs are the fastest growing phenomenon in healthcare, but health benefits move rather slowly. And health benefits and HRAs allow you to take your money and buy your own policy, a policy that's independent of your employer that you keep till age 65.
Okay. Now, it's so interesting. So what you're advocating is that we have to take charge of our health insurance, and the sooner that we can do that, the better. What about health savings accounts? Another new solution, right?
Health savings accounts are new. They came out and they were passed in 2003 and started in 2004. They're growing a lot slower than many of us expected. Today,
Why?
They're pretty complex.
Yeah.
You've got to first get a health insurance policy that's high deductible and meets certain qualifications. Then you've got to go to a bank and open a health savings account. Now, that said, every American should have a health savings account because it's like a super 401k or an IRA on steroids. With an IRA or 401k, you put money in, you get a deduction. But when you take it out, you pay ordinary income taxes, even on capital gains. With an HSA, you put money in, and when you take it out for medical purposes, it's totally tax-free. Now, it's only $5,250 a year you can put in, but that's still a sizable amount of money over time. Everyone should have a health savings account. But that said, 3 years later, about 3 million Americans have a health savings account. In contrast, HRAs, which were only really a year old covering premiums, 11 million Americans have an HRA.
In making health insurance affordable, the know-how is in the knowledge, and we provide step-by-step guides and instruction with intuitive user interface tools that make it almost fun for the individuals who sign up for our self-serve portal. The advantages to our employers is that it allows employers to define and control their costs, provides greater tax incentives for both employer as well as employees, robust custom plan designs, no participation requirements, no open enrollment restrictions, and no COBRA administration. The advantages to our employees is the online learning center, online enrollment automation, online user community, easy user tools and interface, chat help desk support tools, world-class benefits department, world-class local benefits advisor in most states, and many more advantages. Switching your employees to our benefit platform is simple and easy to do. First, establish your QSC HRA. Typically takes about 15 to 20 minutes. Next, establish your monthly contribution. This is how much you want to spend and budget for your monthly benefits. Third is drop your group coverage. And last is send your employees to MMHIA website to sign up for their personal benefit account. And that's it. Thanks for watching. A Better Benefits portal is just a click away. Register today and start saving now. Or get your questions answered by scheduling an appointment with us or call us toll-free at 1-844-533-7432. Thanks again and go out and make it a great day.